Okay, so for the first step in the return to play, this is more focused on the mentorship content in terms of assessing and really getting the patient to get good ribcage mobility, challenge the base of support. But what I want to do is I want to give you an overview of this anyway so you have an idea. But ultimately, whatever you do in terms of your assessments, your treatment, you will be doing at phase one. Okay, so phase one is we want an ability to produce force at submaximal loads, and we want to have a baseline level of load tolerance on the bed, and we want to challenge the base of support. So again, a very important thing to understand is most injuries happen at submaximal load levels. You know, we use assessments of maximal contractions, but ultimately we have to ask ourselves the question, where do most injuries happen? Most injuries are happening when the muscles aren't contracting maximally. Okay, of course some do, but not all of them. So submaximal levels of load testing, that's something I teach in the mentorship, how to do that. Other thing we want to look at is the ribcage mobility. So again, when someone goes to touch the toes, backward bend, side bend, what's happening with the ribcage? Is the ribcage depressing when we touch the toes and retracting? Is it elevating as we extend? Is it elevating on this side as I side flex, depressing on this side? My diaphragm needs to lengthen as I touch my toes. It needs to shorten as I extend. It needs to shorten on this side as I side flex, lengthen and dome this side when I side flex. Okay, so again, that's going to be very important that we can do that. You can see if we don't get that doming of the diaphragm, the TVA, the rectus abdominis, all of these muscles are going to be affected because the rib cage isn't going to be able to depress. So that diaphragm's important, that we want it to go through a full range of motion in order to allow all of these tissues to work. And again, in the transverse plane, as I rotate, I want my diaphragm to be able to go through a full range of motion. Again, a lot of people, they hold their breath. When we're stressed, when we have anxiety, that can all affect the ability of that diaphragm to go through a full range of motion. As I said, in situations of emotional stress, the diaphragm showing signs of hypertonicity, becoming flat and immobile essentially. So again, we lose that ability to lengthen the diaphragm as a motor adaptation that we talked about, just like with all of our other injuries. So the importance of that to the peripheral tissues, you can see when I elevate the rib cage, I'm going to influence the length tension of the hamstring. So again, a big one that I see is a lot of patients, they'll lose the ability to depress the rib cage. They'll essentially have an elevated rib cage. That's going to have tension on the hamstrings. Your receptors in your hamstrings are going to be screaming at you. My hamstrings feel tight, but you can see here through the video that the hamstrings are actually long. Okay, so they're actually already stretched. So you'll feel like you want to stretch them, but actually it'll be the receptors being stimulated, in my opinion. So what we want to do here is, rather than look at the hamstrings, let's get that rib cage to go through a full range of motion. We may or may not have to influence the diaphragm through breathing work or whatever you want to use. And then ultimately, we'll influence the pelvis, influence the rib cage. We'll take those receptors, we'll quieten those receptors down, and very often the patient won't feel like they've got tight hamstrings anymore. So the rib cage, as I said, it's going to be very important that we have a full range of motion to the rib cage, because ultimately we want all of these tissues to be able to be accessed to keep us balanced when there's a perturbation happening. So again, when I go to touch my toes, I want all of this rib cage to depress, retract. I want the rib cage to elevate. I want the rib cage to elevate, depress. And I want the rib cage to be able to go through a full range of motion. I want the obliques to go through a full range of motion. So again, your assessment that you use is going to be very important. I teach a certain way in the mentorship. But if you're not on the mentorship, then obviously you're going to need to have your way of doing this as well, so that you can work smarter, not harder. And again, we can see people with back pain. We can see that the diaphragm, it just doesn't go through as much a range of motion. So that's going to be key to allow the rib cage to mobilize. And again, remember, we talked a lot about the importance of the rib cage relaxing, the head relaxing, to get more load on the peripheral tissues to allow them to build tension again. Okay. So again, a classic example here of a player, this guy had a quad tear, an adductor tear, and a calf tear all in the same year. And then when we looked at him, okay, so frontal plane or sagittal plane is pretty good, but frontal plane, he's not challenging his base of support here. So you can see the hip, it's not going outside the base of support. Okay, it doesn't look very balanced there when he side flexes. I could just push him over there easily. Whereas transverse plane, he's not too bad. Okay, so again, it wasn't a glute med issue. We needed to help his rib cage elevate. Okay, and again, we get that rib cage moving. Now he's got more movement options. He can challenge his base of support. He can decelerate his body weight with his lateral hip and his lateral obliques here as well. So again, he's going to feel like he's got more movement options. especially in that frontal plane. So a lot of his stuff, the 20%, it's respect the muscle tear, but the 80% was taking him through a graded exposure in the frontal plane. So we're actually doing a lot of the exercises I'm going to show you today actually in the frontal plane. So really important that you have some baseline assessment, that you've got a submaximal load tolerance test, and that you've got some kind of assessment where you can assess the ability of the rib cage to go through full range of motion, the ability to challenge the base of support, and ultimately we can do that in 3 planes. Then we can start to get up to the higher level exercises, which I'm going to show you next.